Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Welcome back to the FU Cancer Podcast. Today, we will be discussing a topic that has really surged in popularity and availability since the COVID-19 global pandemic, telehealth. So sometimes referred to as telemedicine, telehealth lets you see your healthcare provider without going into their office. You can have a telehealth visit online using your computer, your tablet, or your smartphone, all from the comfort of your own home. But is telehealth really the right option for individuals battling cancer? Joining me today is telehealth expert and registered dietitian nutritionist, Michele Rager. Michele has been a longtime friend and colleague of mine. She's a dietitian with over 20 years of experience in healthcare and technology. She holds an advanced practice certification in clinical nutrition. She's been recognized as a fellow of the Academy of Nutrition and Dietetics, and she's a commissioner with the Commission on Dietetic Registration. Michele's work experience includes serving as a vice president of clinical nutrition for Season Health, where she led Season's clinical teams in developing and delivering nutrition-related components of digital food as medicine, really as a prevention and treatment approach to managing chronic disease. Michele's passion really lies in building cutting-edge nutrition-related products and services, really with the potential to transform the health and wellness space. So, Michele, thank you so much for joining us today on the FU Cancer Podcast.
Thank you for inviting me.
So, what are some of the benefits of telehealth?
Well, telehealth offers several potential advantages, both for providers and clinicians, and then also for patients. For providers and clinicians, offering visits via telehealth is an opportunity to expand their reach and reduce costs. Expand their reach because they can see patients outside of the normal travel radius to a physical office location, and then also reducing costs because telehealth can really streamline care and lessen a practice's overhead. And then for patients, telehealth visits are really a convenient way to be able to access care from any location where you have an internet connection available, including from the comfort of your own home. Telehealth can improve access to all types of care. There has been a lot of research about the parity of telehealth versus in-person visits. And this may give you access to specialists that you might not otherwise be able to conveniently see. So I mentioned the reduction in time and cost on the provider side, but also telehealth can reduce time and cost on the patient side, just related to lessening the need for travel to and from an office. And then I think, kind of importantly, in certain populations, for those with maybe weakened immune systems, it may protect you from needing to be able to be exposed to others who are sick as you go into a traditional office space.
Well, and I know personally, I experienced really a benefit as a mom with two young kids at home. I've been able to do telehealth visits for my kiddos who are sick, and nobody wants to take a sick kid out into the public
Yep.
for really reasons you mentioned and just for convenience factors. So really, telehealth, I think, does have a lot of benefits for our consumers.
Yeah, and I think just on that personal note, I also, have kiddos at home, and I know we've been able to attend therapy sessions virtually and take advantage of lots of different provider types where you don't have to be missing school. You can just kind of tag something on to the beginning or the end of the day and not worry about, missing school and that time and travel. So, always expanding. There are lots of types of providers that you can see via telehealth, and I know we'll talk about that in a couple minutes as well.
Michele, are there any situations where telemedicine really isn't a good option for a patient?
Yeah, I think that there are cases where it might not be a good option when there's a need for a comprehensive physical examination, or for whatever reason, if the patient is unable to access the technology required for a telehealth visit. Also, obviously, I think telehealth is not generally considered appropriate in a life-threatening emergency situation where there's an immediate physical intervention required. That being said, there is new technology being developed all the time to support a variety of types of telehealth care, including, for example, now things, devices that can monitor weight or blood pressure or even listen to heart or lung sounds remotely. So we're really stretching the boundaries of what was once possible to move into the next generation of telehealth care.
So, in your experience, does insurance companies, do they typically cover telehealth visits at the same level as in-person care?
I would say historically, no. And then the pandemic happened for us, and that changed the telehealth landscape. I think where folks were not, by and large, accessing healthcare via telehealth visits previously. Lots of the legislation changed. The ability to access or cover telehealth visits changed in a lot of states and for a lot of types of insurance. There are still many nuances here depending on the state where you live, the type of insurance you have, or the reason for your visit. However, in many cases, telehealth care is covered the same as an in-person visit. I would recommend always verifying the specific details with your insurance plan to understand whether those services are covered and what costs might apply prior to making a telehealth appointment.
Well, and I know you and I both, some of the area that we've oversected is licensure for dietitians. And I know there's some rules and requirements around where you can seek care and can practitioners cross state lines. So, what are your thoughts on that element of telehealth?
Yeah, so I think it depends on the provider type. Many types of care are readily available nationally and can easily be provided. So I point to docs and medical and nursing care. Typically, you can access that nationally. So there are many types of services, including things like Teledoc, where you can access that care pretty readily. I would say for nutrition care, it's been a little bit more fragmented for us. Again, historically, prior to the pandemic, lots of states did not provide any type of coverage for telehealth care. Now, in many cases, they do, but the licensure still hasn't quite caught up. And so, many dietitians, for example, have sought licenses across many states in order to be able to provide care. And I think that's important, pretty often when you might be located really close to the boundary of certain states or where you might be contracted with certain providers that may be providing cross-state care. Certainly there are many provider types that are practicing nationally now, and again, that reach to be able to extend that reach is really something that we've had the opportunity to take advantage of post-pandemic. But I think, there are many ways that the policy and the legislation still has a little room to catch up and to carry us into the future.
Well, let's talk technology for just a minute. So, how user-friendly is telehealth?
I think in most cases, it is very user-friendly. Many providers use secure platforms that can be accessed either with a simple login or via something that requires no login at all. You can access typically from a variety of types of devices. So, whether you're trying to get that telehealth visit completed on your phone or on your computer or on your tablet, typically you're able to do that. And all that's needed is a standard internet connection. Also, depending on the provider type, you may be able to book that telehealth visit much sooner than you can, the wait time for an in-person visit. So, in that sense, I would say telehealth visits are very user-friendly.
So, what advice would you give our listeners who are using telehealth to connect with their healthcare providers, really thinking about how they can, get the most out of that visit with their provider?
Yeah, I think I would recommend that you first consider your personal needs or preferences for visits to determine whether telehealth is right for you. Just as a baseline, do you prefer to travel to an office? Do you want to speak with someone in person? Or do you prefer to connect from work or home and, connect online? Is the type of care you're seeking available via telehealth? I think is another important question. And will your insurance cover that particular type of visit? But if you do decide that telehealth is right for you, I think to get the most from those visits, I would recommend testing your technology ahead of the visit to be sure that you're ready and able to join at the appropriate time. I can't tell you how many times we've seen individuals that, they think that they're ready to connect and they're just, not able to, or they have some snags in the tech and it takes a little while to connect. We usually eventually get there, but I think, just being ready and having tested ahead of time will decrease your frustration and ensure you have the most time for that visit. And then I think another thing is really treating telehealth visits like you would any traditional in-person medical appointment. You should plan to dress appropriately. You should plan to join the appointment from a quiet, private place where you can comfortably discuss health-related topics or issues. And I think, where you can focus on your discussion with the provider without unnecessary distractions. And also, I think if you require any accommodations due to a disability, or if you speak a language other than that of the care provider, you should be sure to provide that information to the provider ahead of the visit so they can be prepared with support or translation services or anything else that might be needed to ensure that you have an optimal experience.
Well, Michele, thank you so much. It's always such a pleasure to talk with you. So thank you so much for joining us today on this episode.
Thank you again. It's been a pleasure to be here.
And listeners, we hope you've enjoyed today's content. Be sure that you like or follow this podcast on Spotify, Apple Podcast, Apple Music, or wherever you listen to your favorite content. And to learn more about the FU Cancer platform, please visit our website at fucancer.health. Until next time, I'm Christina Rollins. Thanks for listening.